Good morning. This is the Board of Health meeting for December 16th in room 12 of the Town Hall. And just to let you know that this is a live broadcast this morning. So, good morning, everybody.
Good morning.
And
Mrs. B?
Start off with approval of the minutes for November 20th, 2019.
I make a motion, we approve the minutes.
I second it.
All in favor?
Aye.
Okay, new business. I'm going to talk about the Alex Berenson community presentation. Alex Berenson is an author of Tell Your Child the Truth About Marijuana, Mental Illness, and Violence. And he is going to have a community presentation on the marijuana truths and risks that is going to be presented at the Norwood High School Auditorium January 9th of next year at 7 p.m. You can register at www.impactnorwood.org/upcoming events. There is childcare available, and also you may have the chance to win a $100 Bertucci's gift certificate. So,
Do we know if people can bring their school-age children to hear the presentation, Kath? It says child care available, but
childcare
what do you think?
available, but
The target is more adults and parents.
adults and
Okay,
parents.
okay.
Yeah, older children could go, but I think the message will resonate more with adults.
Okay. Unfortunately, you have to be there to win the certificate.
Yeah. But it sounds like a very interesting topic.
His book is wonderful. I don't know,
I have not read it as yet, but it does sound very interesting, and if you're interested in, just make sure you register beforehand so we know how many people are coming.
Yeah, and registration's not necessary, it just helps us get a handle on the numbers.
The numbers.
So if you don't register, you can still come,
You
but
can still come.
if you don't mind register, that would help us.
What's good about it is there's childcare offered, so, people who have young children who want to hear about it can come. So, all right, moving
to her
right
about
along. FDA grant awards. I'll let you.
Yeah, so I just
Okay.
included the award letters. There are two FDA grants. Start with the smaller one. Is we actually I apply for this one every year, and what we do is we pay for Angela to go to the Mass Health Officers annual conference. So we use grant funds for that. So that's a smaller one, anywhere between $1,000 to $1,200. But this year we applied for a larger grant. Where we received a $20,000 grant to do a risk factor study. So this involves working with a consultant to go out and do a survey of our establishments, sampling different kinds, and to come up with a baseline for us of the types of critical violations that we see in Norwood. And what it does is it creates that, just like I said, a baseline, and then every 5 years you repeat the study and to see, so it's a measure of the effectiveness of your food program. Are you really decreasing the amount of critical violations you're seeing out there and creating healthier food establishments, safer food
It's a
establishments.
little more work for.
I was going to say, how does that
everybody
impact
here, but,
Angelo?
yeah.
Angela and I will be working a lot on it, and then I hope to send out requests for proposals at the beginning of the year.
Nice.
And we have all 2020 to work on it. We need to submit the final report in December, so a year from now.
Oh, that's great.
Do restaurants have to participate in this and know this, or this is all?
We'll be sending information out to them because there will be an independent contractor going out there and performing the risk assessment for each establishment. And it won't be every establishment. We do a sampling of the different kinds. So we will communicate with them to say that they're working on a project with the health department. Please be cooperative.
Okay.
And they will have to interact, like the contractor will ask them questions, testing their knowledge. It's similar to an inspection, but it's done separately as a study.
That's good.
Well, it actually probably will benefit them in the long run too, so that we kind of standardize what everything is, and so even though we have standards now, it'll help to improve the standards of all of the facilities that we run.
But we're going to ask for their participation. We're going to
Right.
send out a letter and ask for them to participate in it, right?
No,
Is that what you said, no?
We'll send a letter to say this.
to say it's going to happen.
Oh,
It's gonna
okay.
happen, yeah.
Okay.
But they won't, we won't pick out the.
No, that's what I was saying, yeah, okay.
They'll actually be randomly selected, so we'll create them into the 4 or 5 categories. Schools, food service, deli, so there's several categories that the FDA subdivides food establishments in, and then we have to get a sampling from each one. So it's really a sample study, where we're a smaller jurisdiction and compared to like a large county, because this is a national program. A good percentage of our establishments will be inspected because of the sample size. If you're in a larger county, you can have a smaller sample size. well, you can have less of your percentage, not smaller sample size, less percentage of your establishments, but because we need a certain minimum, most of our places will probably be inspected. Food service, not retail.
Not retail, okay. And they give you guidelines that you have to follow for that, correct?
For sure, yes.
Good. That's good. All right. Mass Department of Public Health Weekly Flu Report. I did just get the most recent one that just came out this morning. It says that the influenza severity for Massachusetts is low this week. Hospitalizations in Massachusetts are low compared to the last two flu seasons in the same week. The 2019-2020 flu season has a comparable number of influenza A and B positive specimens, but where nationally influenza illness activity is increasing, being caused mostly by influenza B, which I'm sure Karen will show us that in her report, that she's seeing more influenza B reports in this area as well.
Does the A and B have anything to do with the difference in immunizations, that we got the shots, the flu shots? No. It doesn't mean maybe one's getting more A because they didn't get the 65 and older, or the B, it has nothing to do with that scale. Okay.
So we issue the quadrivalent, which has the 4 strains in it.
Right.
And you can see the 4 strains listed on the chart here. It's always, what they don't know is how well the match will be against each strain.
Oh, I know that with the year we did it.
But we definitely issue the
What
4
concerned me was, though,
strain.
that it said that the activity for Massachusetts is increasing and is higher than the previous 2 years for the same week.
Kathy is reporting on the one issued out this morning. They come out every Monday.
Yeah.
So you have last week's.
Okay.
Because the folders went out earlier, but Kathy and I printed the one for this week. So
Okay.
it fluctuates week to week.
Week to
Yeah.
week it fluctuates, okay.
Well, I would imagine that.
Yeah.
The news
Well-
said it was high. I mean, the news channel's the same, that it's high in hospitals.
Yeah, it's consistent with week to week
For this
overall.
time of
It's consistent
year,
for this
Yeah,
time of year.
and
consistent.
that's the only thing that concerned me, is that it said that it was higher than the previous,
That's right.
previous
2
2 years.
years,
So, does that mean it's going to keep, I suppose it'll go up and down, but still, if it started to be higher this early in the
It pretty
season, then it's
much,
probably,
it pretty much starts low December and January, and right around February, school vacation is when you
when everybody.
really start to see, from the years I worked in the hospital, you used to see the spike right around school vacation week.
Oh, great.
And it would hit around that time and stay through until March and start to decline in April. But
Yeah.
And I always am a very, visual person, so on page 2 is the chart of influenza-like illness visits to,
Oh, yeah.
it's again a sampling across the state of doctor's offices.
Hospitalization, yeah.
yeah.
The second one is hospitalizations. The first one is just reports, which is really the best measure of, because not everybody's going to go to the hospital with flu.
Right.
So it's sort of trying to capture what flu activity is out in the whole community.
What would warrant the hospitalization of a person with the flu? Elderly, I understand, but what would warrant a healthy 13-year-old that got the flu to be hospitalized?
Dehydration.
Yeah, respiratory distress, uncontrolled fever.
Oh, okay.
Yeah, and
You know,
About the same symptoms as an
underlying-
adult then?
Yeah.
Underlying causes too, underlying
conditions.
conditions. You know, if a child has asthma, that's
Oh,
gonna
okay.
increase their risk of being admitted with the flu. If they're immunosuppressed, that's probably gonna
Okay.
increase their risk of being admitted with symptoms of the flu. Just because you want to get them early, and you don't want to, you want to get them before they get really sick and they require longer stay. With the elderly, it's harder because they wait. They don't like to go to the doctors or the hospital. They don't like the hospital's wait. And so a lot of them get sicker because they wait longer. They think, oh, I'll just take my Tylenol, my fluids, and I'll be better. But they don't always. So they wait and they get sicker.
And definitely want to advise people, something like that, to call their
Go to the-
doctor.
Right, call their doctors, at least touch base with their doctors, because they can tell them if,
They have an idea on what their
their
overall
history
health
is,
is, yeah.
and if they
Exactly.
feel that and plus they can, they can see them in the doctor's office as opposed to them having to go to the hospital. And if they feel they need to get them on the the different anti-flu medications that are out there, they can do that. So they can get them started early. Those medications only work if you get them just as the symptoms start. So you can't really wait until you're in the full throngs of it, so.
Okay, thank you, that was very good.
All right, so we're moving on to old business. And first up on old business is the nurse's report.
Step up to the plate.
Good morning.
Morning.
Morning, Karen.
So in reference to the flu, we don't usually see flu B this time of year to the degree that we have. So far, we have 15 reported cases of flu, to date. Doesn't mean that that's all that's,
Some people just don't bother
Right.
calling and doctors.
oh, they haven't been tested.
Yeah, those are lab
Right, those are
confirmed
lab
cases.
confirmed
Lab
cases.
confirmed.
Right,
Okay.
right, there's likely more. But we usually see B later on in the season.
But we're seeing B
We're
now?
seeing B now.
Wow.
So of the 15 cases that have been reported to me, 1 was A and 14 B.
Wow,
So that's what we've seen so far.
that's not good.
Well, it makes you wonder a little bit if the vaccine is not as strong on B and stronger on A. We don't know.
So
This
hard
is-
to know.
Yeah, and we're such a
Right.
small sample
Small
size.
sample,
So we-
right.
The state report is
We go
really
by the
better.
state.
Yeah.
Right,
The state and the CDC reports are really a better measurement of what's circulating.
right.
But yeah, that
Right.
is a little unusual, and Karen noted that when we
Yeah.
were just talking about it.
Yeah, yeah.
We always say no flu season is the same now.
No.
Year to year, there's
Right.
always
There are always
There's
something.
always, yeah, room for
And
differences.
expect them to be a heavy season and it's light, and then you expect it to be light and it gets heavy, so.
Yeah, there's no way to
There's
tell at
no
this
way to
point in
tell.
time. Yeah, yeah.
So, I'm glad to see Lyme is down to one that's been reported.
At least for now, for now.
Yeah. Hepatitis C, well, so. Okay. Anything good you want to tell us about? All righty.
To think about that.
We have the reimbursements coming in for flu vaccine.
Oh, that's right, that's
That's
right.
good.
Yes, exactly.
Do we have
So-
any doses left?
We do not. We
All right.
gave our full 700 doses. We were finished by the early part of November. So there was a good demand for it, and we hope that everyone who did not get it from us is certainly still getting it if they haven't gotten it up
I
till
think that's
now.
important,
Very
Karen, to
important.
say is that even if you haven't got it yet,
Still
you can
can
Right.
still
Oh, there's
get it.
still time. It-
still time to get it before it really whacks everybody.
Right,
Yep.
right, and as soon as possible.
I mean, there's so many weenies out there that don't want to get that shot because they think it's going to hurt. But, for the 2 seconds that you take the shot, it's so well worth it, so.
It's so important.
Yeah.
Well,
that
they
you don't
they
get it.
think that if they get the flu, they get the shot, then they can get the flu.
Right.
Well, you can still get the flu even though you get but it decreases your risk of getting it.
Right.
And so if you haven't gotten it at all, it increases your risk of getting the flu. And it's
Right.
not a live virus, so it's.
No.
If,
No.
if you got sick, you might
It's a
have been
dangerous
sick when you
disease.
been sick and didn't know it when you got the vaccine too. So.
Right.
Yeah, you do
Very
not get,
important.
you can't get the flu
Cannot
from the vaccine.
Get influenza.
But I think
from-
your point is that you might still get sick from flu later on if you got the vaccine, but hopefully it would be lesser.
Right.
And it depends year to year on the match.
Yeah.
So it's not a guarantee you won't get it, but it definitely does protect you and lessens your
Ups your
chance.
chances, yeah.
Yeah.
Not getting it.
Right.
I want to ask you, Karen, do we get any of the Stop the Bleed training? Don't they have kits out there now that they have available?
So if you attend a training, you will get a kit with
Okay.
some of the gauze, the packing materials. You need to, if you want a tourniquet, you need to order the most effective
I thought that
ones.
they would give you the tourniquet as well. They don't, huh? I
They-
mean, there's so many
they
different kinds
didn't.
of tourniquets. Well, will the town, I think that would be an important thing for the DPW to have available to them, if
Yeah.
we could order something like that, to them.
We did get, those first
What
aid
are we
kits.
using the tourniquet
No.
for?
Stop the
Stop the
bleeding.
Yeah, why
bleeding.
don't we back up, and Karen, if you could just tell them what Stop the Bleed is.
So Stop the Bleed is a training that they're trying to universally give to everyone. to manage a situation where a person might have a severed artery or severe bleeding due to an injury, car accident. You never know what you're going to come in contact with and what needs a person may have. But there's a correct way to stop bleeding effectively, and it can save a life. People can bleed out very quickly if an artery is severed. So it's just training,
Where do we get the training?
We could certainly request.
Does the town give it to the townspeople, or is there a class, or?
There are, not at this time, there
Okay,
isn't, but there
all right.
there are, if we were to, just like with CPR training, if we
Yeah.
wanted to have a training like that, we could
I think
arrange
that
for
would be
it.
important for the fire department, especially for the EMTs and
Well,
stuff.
they-
I'm sure they've
Well,
already
they
got
certainly
it.
got that down
They
pat.
probably already
may
have it
already.
as
They
part
have
of
the kits and stuff
paramedic.
like that.
Oh, I'm sure they do.
Yeah.
And first responders
But I
as
mean,
well, I think
you know, the
that's part
police
of it.
department should have something like this available, and some of the kits, I don't know if you want them for every car, but.
When you even have an emergency kit in like my trunk, that when I open it, there's a tourniquet in there. Now, it's fairly a new kit.
I
There's a
can-
light, there's a tourniquet,
Some
there's
tourniquets are
gauze.
more effective than others, so
Others.
that's what I learned from, I knew it already, but it was
The
reinforced by
thick
this training
2-inch,
that
what's the,
there's specific ones that, I forget the brand name that they were talking about, but.
when I worked with the doctors, there was a small tubular one that was for an IV, and then there was a
Right.
thicker
This is a
one.
heavy, thick, it has a turn.
Oh, no,
Yeah.
everything's
Yeah.
brand new.
Well, the other piece
You
of
don't
it
flap
is,
it up and put it
you know,
underneath, and
Placement, you have
Yeah,
to be
yeah,
careful
it's-
with placement, and so that's
Right.
probably why.
Right, that's what the training.
That's what
that's
I would
why the
like that.
training is
Yeah.
all about.
We could
because-
certainly look into
do
that.
the school
Well, we
nurses know
do-
this?
Yes, they have had the training already.
The school nurses have
They
had
have
this
had the
training.
training.
That's
Yeah.
definitely what I want to know. And then the athletic trainers.
Yes, that was offered to them.
Okay,
It is offered pretty routinely as a medical reserve corps, regionally and locally.
okay. As long as the schools have it, I feel a lot comfortable with that. That the trainers have it, athletic trainers. Somebody at all sporting events in Norwood have had that training for the kids. That's
Right.
great.
And I'm not sure that the police and fire have specific training, but I think it's part of their educational pieces for first responder, for police, and then paramedic and EMT for the fire department. I would assume that
When
that's a big
responding
part
to
of,
emergencies.
yeah, I
We
would
need
assume that that's a big part of their training for that. anyway.
Yeah, this is more a layman's training for
layman's
someone that doesn't
training.
have a medical
Right,
background or.
Right, right.
Exactly.
Not a first responder. If you happen to come across somebody that's been in a car accident or had a shark bite. I don't know if we're gonna run across that, Norm, but.
I'm certainly interested, as Jody said. I don't know how to do it, but I'm certainly would be interested if you could keep me updated on when the classes are, so that we could know as a
Get some
board.
information.
Thank
Yeah,
you,
okay.
thank you, Karen.
We could send out the medical reserve corps training
Yeah.
schedule.
All right. That's a good idea.
Good.
Thank you.
All right.
You're welcome.
Thank you, Karen.
And Merry Christmas.
Thank you.
Are you done with her, Jody? You done with her? Merry Christmas.
Yes.
Okay, Drug-Free Communities Grant Program. Audrey, step up to the plate.
Good morning.
Morning.
All right, so last week was a super busy week for Impact Norwood. I conducted 5 focus groups last week, 6, 8, 9, 10, and 12. And then I will
happened
be
to
doing...
7?
I was just gonna say, what the
Well,
7th graders do?
Getting there. 7th and 11th grade I'll be doing after winter break. It just didn't fit into the schedule this week. And the purpose of those focus groups, we are starting to collect information to launch our social norms campaign. A social norms campaign is when you address the misperception of something in the community or in the school. So for example, if all the students at the high school and middle school think that all of their peers are drinking or using marijuana, the chances of them doing those things are higher, but if you address the misperception, and focus on the fact that the majority of their peers are making positive decisions and not using alcohol or marijuana, it can change their behavior. So we're starting to work on that, and the focus groups are just a way for us to get more data and understand what the misperceptions are. So we did
Are these classes
those.
mandatory? Do you take over an hour of the school? Do you go So,
The-
do you, in the auditorium with all the sixth graders, all the seventh graders?
Nope. So focus groups, they should be smaller. So Mr. Quigley, he's the health and wellness chair. He coordinated it, so I was able to go into health and PE classes. So the focus groups had anywhere from about like 15 to 25 students.
Oh, so not everybody gets it, that's,
No, but I mean, it's a good sample size. We have a lot of data from the Metro West Health Survey that surveyed all of the students, and then the focus groups are just kind of additional information that we can get from students. And then we will also be asking members of the community some of the questions that we ask the students to get their perspective as well.
do the students, do you find they ask you questions, Aubrey? Higher grades, I'm sure the sixth graders don't, I think.
Yes and no. So we have good discussion, but they don't typically ask a ton of questions to us since we're there asking them questions. And the point of the focus groups isn't to educate or give them information. It's just to get their perspective on things. So that's what we did.
That's pretty interesting.
Yeah, it's
All the
been
different perspectives.
it's been really fun, and I have to give a huge thank you to Mr. Quigley for setting those up. A huge thank you to Jen for coming and taking notes during the focus groups, and to Daryl as well. He helped with
How
those.
long do they take these?
About 45 minutes. Yeah, about 45 minutes.
Could I possibly go to listen to one of them?
We can chat about that.
Okay.
Yeah. We we can chat about it. We try to limit the adult presence in the room
okay.
because they're more likely to open up. With fewer adults, the teachers don't even stay in the room. And
Oh, that's great.
yeah.
Oh, that's
we
great.
sent out permission forms also, so
Oh, that's even wonderful.
parents had
Okay.
knowledge.
Gotcha. No, I think that's,
But if you want to, go ahead.
No, I was just gonna say, there'll be a report produced, and so we will be able to share that information.
Okay, that's
obviously
great.
anonymously, without
Right.
kids' names attached to it,
Right.
of what they say. And the reason why, back up a little, the reason why we do this and how it informs our efforts.
You want me to do that?
Yeah,
right
just
now?
a quick,
Oh,
like-
sorry. You can take that.
Okay, well, one of the key, understanding the youth perspective and the youth views is key to any of our work that we do. And what's the saying, not for us.
Oh, nothing about us without us. Yeah.
That, us as adults sitting around the table have no idea what's going to influence a child and a youth on their views. So to hear from them is a key aspect. And we did this focus groups when we started working on substance use, and so you need to do them
oh, it's huge.
throughout the time to make sure
I-
that we're being effective.
Yeah. Thank you. Sorry, I'm not
That's
in my
great.
A game this morning.
You probably could have said that much more eloquently than I did, but
Thank you, Aubrey, that's awesome.
Yeah. So that it was
Especially
busy
if you get
week, but-
feedback from them in,
Yeah, it's
work
been
with
really nice. They're very candid. They're
that's great.
honest, which we really appreciate. So,
Are they a little too honest?
no, I don't think there's. Yeah, no, I'm glad that they're telling us everything that they're thinking. So yes, last week was busy. Our youth ambassadors participated in a pretty cool demo on Friday afternoon at our meeting. A local art studio came in and they showed the students some of their offerings. They did some splatter paint, and it's really just a cool way to kind of ease your mind. And the youth were testing it to see if it's something they think their peers would like. So we might bring that into the high school at some point as like an after-school decompression or something around midterms or finals. A room where they can just go in and if they want to throw paint, they can
I
throw
love it.
paint.
Oh,
And
that's an interesting
just
idea.
de-stress a little bit. So that was a lot of fun. And then just some really fun things coming in 2020. As you mentioned before, on January 9th, Alex Berenson is going to be speaking. In February, I'm going back to DC to the CADCA conference with Officer Paul Murphy and 2 students from our Youth Ambassadors program. Very excited to be bringing them. So that's what we have coming up. And then our dodgeball tournament on March 21st.
wonderful.
Yeah, so good things.
thank you, Aubrey.
Yeah,
That's
you're
great.
welcome.
Yeah.
Thank you.
Very busy week.
Yeah.
Thank you, Aubrey.
Thanks.
Do any, Aubrey, do any other towns have someone like you?
Yes.
Every town now does?
Not every town, but Dedham has a
Okay.
Aubrey, yeah.
Okay. No, they don't have an Aubrey, they
They
have
don't have
someone
an Aubrey,
like
they
an
have someone
Aubrey.
like
Thank you,
Well,
Aubrey.
what's kind of neat, if, you remember our SAPSI group, which is that
Yeah.
regional group? Many of the communities that sort of started out doing the work together now have their own drug-free communities grant, just like we
Yeah,
did. So it's kind of neat that regionally we have this great increase in capacity to do this type of work.
Do you meet together? Do you group the different towns?
Yep, the SAPSI meets on a monthly basis,
Oh,
and that's led by Carol and Needham. They're the host agency.
Oh, okay, good. Excellent,
Sorry.
that's okay. All right, and now we are on to our food safety reports. Angela,
Yes.
do you want to start with the updates?
Absolutely. So the update list, we had 3 establishments on here. The first one was Norwood Center Pizza and Grill. They are still closed.
Okay.
They are, again, aware that they need to call us before they reopen for an inspection.
And they were closed, I missed the last meeting, they were closed from us? We closed
No,
them?
they closed themselves.
Okay.
Correct. I know Jen's been in touch with the owner like last week.
Yes.
And that's what he told us.
Where's that, Jen?
His name is Ilya.
No,
And
the address?
Oh, I'm sorry, 514 Washington?
Oh.
The old
Sokos.
It's the old Sokos.
Oh, okay, thank you.
Yes, so the owner has been in. They are hoping to hire a new chef to be running the restaurant sometime in early 2020.
Okay, thank you.
Crushed peppers, there was a re-inspection conducted, I believe last week or 2 weeks ago. There were no red priority violations observed.
Were there,
No.
were there violations at all?
There was one for toilet paper, which was a core violation, which is a non-critical. But anyway,
Okay.
so we can take them off the list. So,
Okay.
the other establishment on the update list is Cedar Market. I did an inspection there last week. Their live pest activity, there was none observed during the inspection. I received their most recent pest control report. The activity is decreasing. I was in touch with the pest control technician who services the facility. He said he's done the best he could to seal up some of the areas, but it's still a work in progress.
Okay.
So I'm going to ask him for another report when he goes in there. He's in there weekly, so.
Yeah, I'd like to see
So-
him stay on that.
Absolutely, so
because-
I'll be getting those reports
Yeah.
and then making sure that the activity decreases and hopefully the goal is eliminated, so.
Okay.
Okay, but I think we can take them off the list as I'm due for a routine inspection early 2020.
All of them off?
Month or two. Yes,
Good.
crushed peppers can come off and cedars as well. We'll keep Norwood Center Pizza and Grill on until they open.
Okay. And then,
New food
The new food
establishment.
establishment list? Sure, so Benchmark has officially transferred their ownership, so they'll be coming off the list next week. The other establishments are either at the tail end of their construction phase or in the middle of their construction phase.
okay.
Who is the new people for Benchmark, do you know?
If, I forgot the company's, the new name.
I'm just concerned, I'm not concerned, are there other companies in Norwood already that bought them, or is it a brand new?
No, it's a new, it's
It did sound
Husky
familiar.
something?
Something Husky, yes.
Yeah,
Right.
it's a corporate name, it's Husky's
Yep.
involved in it.
Correct.
Corporate name.
And is
Okay.
Clapboard Street in Norwood?
Yeah,
Yeah.
That part.
That-
That's a newie to
right-
me.
Yeah.
right up by Zavarian, that's
Yeah.
Clabber Tree.
No, I know that's Clapboard Street, but that's Norwood?
That-
Yeah,
up
it's
to
before.
three houses, I
It's
think
on
it
your
is.
left-hand side.
Oh, I didn't
Beginning
know
of
that.
Norwood, yeah.
It's on
It's
your
part of
left-hand side
Polaroid.
before you get to Zavarian.
Learn something new every day.
Across the street from
Yeah,
Yeah.
there's like
Thank
three,
But it's still
three houses.
Zavarian's
like-
in Westwood,
Right.
Yeah.
Further.
just by the way the landmark goes. Okay. All right, so we did the new food establishment, and now we need to do the inspection reports.
Are we gonna do Wallet Massage first, or are we gonna,
Oh, okay.
or is that part of your report? Sigal?
No, Angela
No?
can talk about that,
Okay.
so
You
you
can
can
talk about it.
talk about the follow-up after the hearing.
Yeah.
Sure. So with Victoria's Cafe, we did have an admin hearing, Gretchen Segal and I, with the owner. There were some items that he's going to be working on. And I did a reinspection, I believe, after the admin hearing.
Uh-huh.
I'm sorry, before, and the violations were corrected. He did a good job of minor, I guess, remodel, you would say, of the pizza prep area downstairs. New coat of paint, deep cleaning, coving installed. So I want to keep them on the list for next visit, for the
Okay.
next meeting.
Yeah.
I do want to do a follow-up there.
Okay.
The only thing we're waiting for is, he was supposed to have sent us a checklist.
Checklist, he hasn't.
And he hasn't done so.
Okay.
His wife was in touch with me last week. There was a misunderstanding regarding emailing it, dropping it by, so I will be in touch with her
Okay.
at some point today.
And what about the repair for the cooler? Have they sent you a date for that?
That is with the checklist. That was what we sent with the checklist as well.
Okay.
So
Okay.
we're gonna get those items hopefully
Okay,
sometime
so-
this week.
Yeah, I'd like to
Next day or
definitely
two.
keep
Sure,
them
sure. I'll
on.
definitely keep it on the list for a follow-up for next meeting.
Okay.
Anyone else that you think?
There's one establishment I do want to follow up on. It's Chaboulet.
Oh, yes.
Chinese
that
restaurant,
was
just
one
to
of mine.
follow up there and put them on the list. That is on page, let's see here.
5.
Page 5, yes.
Thank you.
You have a couple of spelling errors there.
I did,
too,
I
but
Yeah.
That's okay.
I circled them.
I did too. I circled them as well. That was a rough one.
That was a busy day.
Yeah, that was a busy.
You're on the wrong keys, that's all.
Is there a language problem there, Angela?
Not at all,
Okay,
no.
thank you.
You just want to do it because you think.
I
that
do,
they
there was
closed
some,
Yeah.
nothing major or imminent.
Yeah.
But there was a lot of items on there that I do want to check up
Okay.
on, follow up on.
I see a lot of this no vomit cleanup kit. Is that a new regulation?
Correct, so every food establishment that carries TCS foods, so perishables, they have to have a vomit cleanup kit with procedures on site.
Okay, so
I
that's a
do-
new regulation.
Correct, it's part of the new food code that was adopted October 2018.
Okay.
Most establishments do have them. The Restaurant Depot sells them, they can get them there when they go shopping for other items.
Okay.
The procedures, I actually give them a copy of our procedures that they can implement as their procedures in the establishment.
Okay.
So, because if you tell them to do it or have them do it,
They're not gonna do it.
Is this also part of your training when you do the restaurant you know, you do the training with the restaurants here? Is
I
that
should-
part of your training?
When I do the
that-
workshop, I do bring a kit with me and
Okay.
show them what it looks like. I open up
Okay.
the bag and let them know what's in there, how to use it.
Okay,
And all that.
good.
I did at a workshop a couple of weeks ago.
Yep.
Did that,
Okay.
so.
Good.
And I tell them what about purchase from Amazon, Restaurant Depot, so,
Okay.
yes. So,
And the IHOP's all set?
I hope it's all set, yes,
Thank you.
yes, absolutely.
The only other one I had a concern about was Shaw's.
Yes.
Yeah, that's,
Are we gonna just skip through everything and just pick out people? Is that what
Well,
we're
no,
gonna-
I was just,
Oh, okay, yeah.
I was going with the ones that I thought Angela might
Okay.
Input.
first, and then if you have others you want to put on there, you can. But we're on page 5 also.
Oh, I had 6, okay.
Yeah, that's-
5 and 6,
five
I
and six,
guess,
correct.
is both.
So, let's see here.
That must have been fun watching a mouse run up the aisle.
Yeah, I was there for a routine inspection. I didn't see any activity. I was there for a routine inspection on November 18th, and the complaints I received a week later for the mice sighting, or the mouse sighting. They are being serviced, I believe it says weekly here because of the construction going on behind the establishment.
Okay,
The store manager, he was honest and said they've noticed an increase in activity due to the construction. I guess they had to install a sewer line,
yeah, and a
which really
gas
disrupted a
line.
lot of their,
Okay.
I guess that's where they borrow, I guess.
Yeah,
That's where
but-
they borrow, so.
Angela, is there any, I don't know this, is it winter that they're more prominent, or is it the heat or mice?
So
Are they
mice-
always there, or?
The mice hate the cold, so mice hate the cold. In the
Oh, mice hate
wintertime,
the
they
cold.
try to find a way inside an establishment.
Okay.
They're looking for a food source, water source.
Okay.
And many times it's a restaurant, a supermarket.
And so many old buildings have entrances that I don't think they know about.
Correct, it's true, yeah, especially the establishments that are connected to each other.
Sure.
You know, we have a lot of those in town, so that makes it difficult.
How about the
Because they travel from place to place.
That's a place-
dumpsters, the big dumpsters in all these places? Do they tend
Shaw's
to?
Shaw's are enclosed, I
The
think.
Shaw's is an enclosed dumpster, it's a
Yeah.
long brown
Okay, I
one.
wondered
You
about
go
that
in the
one
back,
because,
this is hugely
Closed. A lot of
enclosed.
ones that are outside on the premises, those lids have to be closed when they're not in use. I do look at the dumpster area during my inspections and make sure the lids are closed and not overflowing. There's no debris or food in the area underground around the dumpster, which is a food source for
Oh, definitely.
all kinds of animals, rodents, raccoons, rats.
So do you think we need to put them on the list?
I
Or this
wouldn't.
was just a,
Yeah, I didn't see
they're
any-
on top of it? you
I
think?
think they are. They're actually
Okay.
they're getting serviced more than once a week, actually.
Okay.
And whenever they get a complaint or see something, they actually call the technician to come in. I guess he's on call, so to speak, during this time because of the construction. So they're getting serviced more than weekly.
Do you think we ought to add that other little mall that has food where the Boston Market used to be? Any of the restaurants here, because there was such a big turnover of land and all that sort of stuff. I mean, if they're getting all kinds of rodents and, mice and all that stuff, you would think that they would get it, they're on the same, they're closer actually.
Right, so Boston Market is closed.
Closed.
Same Old Place Pizzeria is closed as well. The only food establishment there would be Subway and Shiva Bazaar.
Yeah,
Correct.
Shiva Bazaar I would have a concern for.
Mhm.
They've been on the list. And,
Yeah, I don't remember them having a major pest issue.
but with,
Um,
but have we been there since they started all that construction and building?
I
and
have
stuff
been there,
like that?
yes, correct, yes.
Okay.
I have.
With proper maintenance and exclusion, making sure your building is sealed up, have monitoring stations, I mean, it is possible even in the winter
Oh, sure,
to exclude
yeah.
rodents from your establishment and from your home really too.
Right.
And you want to practice those preventative measures. So if a place is doing a good job at that, they shouldn't have an infestation.
Correct.
All right.
That's all that I have on mine. Is there
thank
anybody
you,
else
Angelo.
that has?
No, I think
have-
covered that most
I
question.
have Victoria's Cafe
Well, we just added them
Yeah.
to the
to
list.
the list.
Yeah. Anyone else? One question I do have is, do we have the certificates from IHOP? Did they send you their
Yes, they're all
copies?
set. I did receive a
Okay.
copy of them, correct. And they came in after the reports were printed.
Okay.
That was the other thing I had.
Anti-choke food manager certificate I received, so.
Yeah.
yeah.
And Kathy stole my thunder. and that was
Yeah.
it.
Sorry.
And can I also update the board on pool inspections?
Okay.
5 out of the 6 year-round pools have been inspected and permitted for 2020.
Okay.
Vanderbilt, Goldfish, Hampton Inn, Residence Inn, and 4 Points have been inspected, along with their whirlpool. The only hotel that is, pool that is closed is Holiday Inn. They said they're not ready, so, doesn't look like they'll be permitted by the end of the year, because we haven't heard back from them.
Okay,
So-
so that means that the pool's not open?
Pool's not open. I've been there several times. There's a sign there, pool's been closed. There's been no people in the pool area. I've
Okay.
gone there, unannounced. So, but,
Okay,
so just to give an update to the board on that. So,
okay,
all right.
great.
Okay,
Okay.
Thank you very much.
Thank you.
yes, well done.
Thank you.
Thank you.
Angela. Okay, we're on to the director's report.
I wanted to sort of focus my report on tobacco and vaping and all, because there have been so many changes and it's really a lot of movement and it's been very confusing for everybody involved. And I think as we look to figure out the new regulations and the bans and the lifting bans and the new laws, really working, we want to be able to communicate with our retailers. We're confused, I'm sure they are too.
Can I
A lot
just-
of changes.
Can I just add one thing?
Sure.
I think a lot of the people have come up to me and questioned the ban versus law.
Exactly.
And I can't explain it. A ban is just a temporary ban, but it doesn't say temporary ban when the governor talks. It just says banned. So what is the difference between a ban and the law?
Right, so the ban is the governor declared a public health emergency and issued a ban on all vape products. That ban ended December 11th, so that's sort of off the table now. On December 11th, the Public Health Council at the state, which is, equivalent to actually a local board, it's the state's Public Health Council, they issued the regulations on the same day. And those regulations are outlined on the second portion of the report here. They require certain things like signage, they limit the concentration of nicotine, strengthen enforcement, what are some other things? Require it to be placed behind the counter. So a lot of the requirements that we put on tobacco, it put on vape products. So that's sort of one path.
Yeah.
So the ban is gone. The ban was sort of an emergency and it was temporary. The confusing thing about the ban is when the ban was lifted, for us, with our regulations, remained the same, which restricted all vape products to adult only. So that was a very big confusion for our retailers, and I completely understand why. They hear on the news the ban is lifted, retailers can sell vape, but not in Norwood because we
We
still
have
had
a
our
separate
regulations.
ban.
Our regulations did not change.
Right.
And there was a lot of understandable confusion on that. So we've been working to try and share the information and say, no, the regulations are the same. No more vape products except in adult only in Norwood.
And there's no adult-only stores.
There's the one.
There's the one adult, but they can't.
But it's closed, it looks like it's for rent.
I did see a rent sign. They haven't surrendered their permit.
It does say for rent.
We've been trying to reach out to them until we get word that they've surrendered their permit.
But they're locked, nobody's in there, there's like, I mean, what I see, me, I drive through town and go, oh, is it open?
Yeah, they did renew their permit for 2020 beforehand. They came in at mid-November because the
Oh, okay,
renewals
so
were
they
sent
missed
out
the
in
cut.
October. So they did renew for 2020, but we did see the sign. We left phone calls and emails, the phone numbers that we had for the store, they're no longer connected. The email for the gentleman and his personal cell phone, we have left messages on, we just haven't heard back.
Yeah, eventually, if we don't hear back, we're going to have to revoke the permit. But until we get notice that they're returning the permit to us, because remember, a permit comes back to us, we are down that number. So
Do we replace
So
that?
that's done, we have none in the town of Norwood.
if they're closed, we have no adult only, which means no vape products.
It means we don't have to, and that license is not for sale. That license cannot be transferred to anyone, because we voted that. Is that correct?
Right. I mean, right, because we would be down by one, and there'd be no more tobacco permits. There would be
But if they sell
would
their
be reduced by
business-
one.
But if they sell their business to somebody else,
And if they still have a valid tobacco permit and they sell their business to somebody who wants a
can
tobacco
keep
permit,
it.
they can transfer that.
They
They
can.
have to
Oh,
apply to
see.
us, yes.
They can,
So you can
which
see it's-
might be what they're actually doing.
trying to do.
Right, and they did pay and renew, and they did all the paperwork for
Okay,
a
so
2020
they've covered
permit.
themselves very well.
Right.
So, but if it doesn't, we don't, never have to issue a smoking license.
adult only.
One of our existing could convert to an adult only.
Just one.
Well, two, because we allowed two. We've capped it at two. So technically, two of our existing permits could convert to
But
adult only.
they still can't sell flavor. They
No
can only
flavor.
No flavor.
Tobacco.
No, and that gets to the top description, which was a law. We're talking about confusion here.
Yeah.
So that's an act modernizing tobacco control law, and that was a law passed by the state legislature. And what that did is that banned all flavored, including mint and menthol, just like we have in Norwood, in everything, cigarettes, e-cigarettes, and chewing tobacco, no flavored. That added a tax, so it brought it up to parity, so e-products are now going to be taxed just like cigarettes. It required that Mass Health and the group insurance cover cessation products, which really goes hand in hand with a lot of this stuff. And they have a whole marketing campaign about cessation in 2020 because we are restricting access to these products, and our goal is for people to stop using them. That is our end goal as public health. So we want to be promoting approved cessation methods. So we will be rolling out some media information on that. Again, restricting the amount of nicotine in the products, in the unflavored products that are allowed. And something that we have discussed here is that it increased the retail fines. Currently, all the fines are 100, 200, and 300 for second, third violations. This law, if we adopt it, which we will make the violations 1,000, 2,000, and 5,000.
And that's quite a chunk, so that they may be less apt to sell to kids than they would
Yep.
do previously.
There are some issues legally on how we do that. We use 21D tickets to issue fines. They are limited to, I think, 300. So we can't use the current method. We would have to issue an order for them to pay a violation. So more to come on that and see how we implement that.
Do we still have the people that are going to be checking to see that they're not selling to minors?
Yes, those are compliance checks.
Okay.
And that's something that I think when we start talking about our budget is looking to fund some more compliance checks. We will get one from our regional group, from the Tobacco Collaborative. But I think we've discussed, and when we were looking at our regulations, that we need to do that much more frequently
Right.
with a target of maybe 4 a year, 1 a quarter.
Right.
Yeah.
So it's not that expensive. I think we estimated about $1,500 to $2,000, and we could do that pretty easily.
Can we retract our vote and vote for no tobacco stores in Norwood, adult tobacco stores? Can we change our vote with the governor changing his laws?
We'll
and
have
put
to
the-
go through the AG and all that stuff next.
We're not
Oh.
the AG. We
No,
would
why?
have to
We voted for only two.
We voted for, oh, you mean
Can we
for
vote
the
for just
number?
one? Yeah, for the one, for freestanding adult tobacco stores in Norwood. Can we
Adult
change that?
only?
Adult only. Can we as a board vote on that?
Well, then that wouldn't that be, what do you want to say, exclusivity?
monopoly.
Yeah.
Yeah,
A what?
we-
A
A
Not a
monopoly.
monopoly, an exclusion, like
Yeah.
not allowing something that's allowed. There have been other towns that capped it at 0, or they've put in other language where you can't convert your establishment, and then they pretty much through language said you can't have adult only. It would involve changing our regulations, going through the public hearing process. I don't know if we want to look at it, but our next iteration of amendments to our regulations, I think that's something we could look at.
Now, I do have a question. We have an adult-only store in Norwood, down on Route 1.
Totally separate issue.
Okay.
Which
They
one's
don't
that?
sell any, they
Oh,
don't sell
oh, oh.
any vaping products or cigarette products or anything like that in that, where it's an
No, they
adult
don't.
only?
They don't have a permit from us. If they are, they're
Okay.
selling illegally. I
Okay.
haven't
I've never
heard.
heard of anything.
Okay,
Was it-
so they don't have a permit?
We
Yeah,
used to,
enemy.
they used to have a food
figured.
permit, but due to the changes in the food code, they do not longer have one.
Okay,
We've never seen them there, we've never been told of it.
And
Okay.
technically, I don't think they're.
so they're not
Classified as adult
considered
only.
an adult, okay.
No.
But I'm sorry, adult only tobacco retail store is what
Okay.
I mean when we say
No, I
adult
just
only.
was checking as to whether that would be considered, could they convert to if they wanted a permit? Because they're not an adult only now? I think they are.
I don't think they're technically adult only
Children can go in.
because it's zoning. Yeah, they're not completely restricted, and that sort of adult only is totally separate, not really under
Okay. All right.
our regulations in any way. They could not get a tobacco permit because we don't have any.
Okay.
You can't add to our. There are no free tobacco permits.
Okay,
No available.
okay.
So the law that the governor put in place is the same law that we have put in place prior to the governor's law about mint, menthol, and
Menthol.
wintergreen. It's a flavor ban now.
The governor didn't put that. The legislator passed a law
Okay,
that
right.
included a statewide flavor ban.
Right.
Permanently. Oh, they
Yes.
can-
Yes.
So there's no mint flavored ban anywhere in the state of Massachusetts you can buy?
Effective, sorry, last
June-
thing I was going to say, effective
June
June
1st.
1st,
June
2020.
1st, right.
So some things went into effect right away, but the flavor ban does not
Yeah.
go into effect until June 1st.
But ours is in place.
But
Ours
ours
is in
is in
place.
place.
Yeah.
Correct.
Yeah, so you can see the confusion. And we're working to get messaging out really in the new year, and we'll start inspections, which we always do. We start more as educational inspections. And we understand there's confusion out there, and we'll work with our retailers to sort through it.
Okay, but there will be adult-only stores now, the way that our regulations are set up, right?
Currently, we allow for 2 adult-only tobacco retail stores.
We didn't do what we did with the cigarettes then, as they closed, that they were off the table?
I don't think we have that language. They fall within our regular list, like we have 33 tobacco permits. They're included in that 33, but we did cap the number. I don't think we did that language where it reduces if one closes to 1 and then 0.
All right, could we check that just to make double sure?
Yeah.
Because if they do close and, and the other one is already closed, then we can,
Well, we only had 1. We only ever had 1.
but we kept it at 2. Okay. All right.
So establishments in our town can no longer sell any of the equipment that goes along with vaping products. Can we sell anything in the town? That's what was my confusion. Can they sell pods? Can they sell the jewel stick?
No.
Can they sell the thing that goes in it?
No.
We can't sell anything in the town.
Right.
Except in the adult-only retail tobacco store.
Right.
But that's what I'm sorry. So they
Which is
can,
closed.
so they can go into this adult tobacco store if it opens again and buy, tobacco products, just like, Lucky's, straight tobacco in pods.
Yep.
Okay. Thank you.
But non-flavored pods?
Oh, no
Non-flavored.
flavored.
Correct.
Just tobacco flavored.
Yeah. Okay.
Yeah,
Lots of
it is, you can understand
a lot
why
of
it's
movement.
confusing.
Oh, yeah.
And then, I should mention, I'm sure there'll be lawsuits.
Oh,
I'm
yeah.
sure
Yeah,
the
yeah,
state
yeah.
will face lawsuits,
Oh,
so, so I'm sure things will be changing again. I mean, we'll see what happens out of the lawsuits.
Aubrey, can I ask you another question? Does this come into your impact, Norwood, at all? The vaping in the schools with the kids and everything? It does?
Oh, yeah. Yeah.
So do you try to explain to the kids a little bit older the law so that they will truly understand it as well?
Yeah, we work really closely with the schools. I know Mr. Quigley, the health and wellness chair, he's made sure that those conversations are happening in
Yeah.
his classes. And,
Yeah.
The schools are doing a really great job about educating the students about the harms and the new laws, and Impact Norwood is going to be doing some, like an awareness week, so.
And Aubrey and I
Thank you.
went in front of school committee and actually talked about the collaboration that we had around vaping and how it's really that community effort that really, I always say, moves the dial. And it was sort of the Board of Health policy, the programs in the schools, testifying, that the schools came and testified at our hearing, that was very
Right,
influential.
yep.
So it's that community-wide effort. No agency can do this alone. And I think a lot of the environment in the state that's happening is changing the culture and the norms around vaping, and that people are understanding the risks, and that this is no longer, you understand that it's not a safe product.
So at the end of the day, we are waiting for the CDC to come across with some kind of law itself, or find what is causing these deaths or health conditions? Is that what the town and the governor and the United States of America is waiting on, for the CDC to put it in place that it is dangerous? And, I mean, they already done that to a
The
certain extent, but we
CDC
need,
doesn't make laws, though.
Oh, they don't.
can
Okay.
influence. They could,
so who makes
They
the
would
law?
do- they
Just
would
the
do the-
local and governing boards like the
yeah.
governor?
yeah.
They would do the research, so they're evaluating
They research, right.
nationwide these cases where people have gotten sick using vape products. So they sort of gather up the information and,
Present
provide the
it to the
information to the
legislature.
lawmakers, such as you and the legislator and the governor and the Public Health Council of the state and
Right.
across the country that use that information to pass policy.
And I think the eventual goal of all of this is to even eradicate smoking as well. That's gonna be a tough step, because there's a lot of people that still smoke, and that's gonna be, but it's a huge health risk, and that'll be a huge undertaking when that comes along, and that might take a long time for that to get, but I think that's the end goal, is to get rid of smoking and get rid of vaping.
Well, look how long it took for people to believe that secondhand smoke
Smoke.
caused cancer. I mean, that took, 10, 15 years
Yeah.
for people to
Yeah.
believe that.
And I mean, I think this was a big leap in the right direction.
I think so.
Most of the people in
And
the
big
world.
tobacco has a lot of money, so
yeah.
once that's gonna be affected, there's gonna be, it's kinda like gun control, it's gonna be a big factor, and
It's a strong lobby.
it's a strong lobby, and I don't know if we'll ever get there, but you never know. Who thought we wouldn't have an anti-telephone law in Massachusetts?
Well, we'll be staying on it.
Texting law, so,
Thank you.
Okay.
Skal, this is very important to the town, to clarify. Every day you read something different.
Yes, it is very confusing. And then, of course, just a summary of
all your
sort of
meetings.
standard activities.
Thank you.
If you have any questions.
Do you have
How are
any
the weekly,
questions, Val?
how are the weekly department head meetings going? I mean, are they finding those really helpful where it comes to interacting with all the other departments?
Yeah, I find them very informative to hear what the other departments are doing, where partnerships might work,
Yeah,
and how we can collaborate better. Yeah, I find them very advantageous.
okay,
I think it's a great thing that we do that.
okay.
Any other questions?
The elder dental is at, we won't be doing that in Norwood anytime soon, the elder dental program.
The clinic?
Yeah,
It circulates through the towns. We had a monopoly on it for a little while, so I
Okay.
think they've been looking at other communities. But we'll have one again in the next couple of years, for sure.
okay. I'm just taking down these. And the Norfolk County and Regional Emergency Planning Meeting, anything new with that?
We continue to work on MRC work and planning. We're focusing on cooling and warming shelters is another part of our planning that we've been working on. We've
Okay.
done a lot. What have you done with the MRC recently? The notices, we had a drill this week.
Yes.
A
Yeah, I was
notification
gonna
drill.
ask about the drill. I remember on going on a drill with Stacy years and years ago.
Right. What we do is just make sure the information that's on there that we have on you is up to date. So we'll send out usually an email
Mm-hmm.
saying,
Oops.
just respond, this is just a drill, if you're available, or first of all, are you getting this message? And then you just respond yes. Then later on, we sometimes have drills that we ask a little more complex questions We
Oh,
might ask
good.
you to answer a few questions or ask you if there was an emergency, could you be ready, say, by 4 p.m.? And then you just put yes. You just follow the directions. And it's really just to keep you in the loop and just to see if you're still out there
Okay.
and available to
So I still
help.
have to turn on my.
You have to turn, yes, you have to check your emails.
Yes, because
Every day.
You are all
Well,
three
I don't know
of
about every day.
I
but
check
I'll-
it.
you are in the medical reserve corps.
Yes, I am.
Right, right.
Yes, you are.
And that's where the Stop the Bleed training, it's on.
I like that. I like the
And a lot of the
medical
Corps
reserve
has
corps.
been trained in that, and it's sort of a repetitive, at least a couple times a year, it's somewhere
It
in the
is.
region. You can get trained on
And
that.
it's on that, on their website?
Is the website up, the new website?
Their website's coming.
Okay.
There's a new website that's coming up that's, it's quite a large region, so sometimes the educational sessions are further, you'd have to travel further than you'd
Like to.
like to, yeah. So you look on it and it'll be updated soon and up live soon, I should say. So we're just
We're
waiting
in a
for
little
that.
transition.
Do you go to all of them?
We
Stace?
try to.
All the trainings?
Yes.
No, we don't
Oh,
go to
not
all
the
the trainings,
trainings,
we go
but
to the
we go to the
meetings.
meetings.
The trainings are for the Corps, for the
Yes.
volunteer Corps. So we don't go to all the trainings. And we're also developing sort of an online training guide, so people don't have to travel and can do some online trainings too.
Yeah, they're web-based with a little test
Thank you.
afterwards.
That was the word I wanted,
Yeah.
web-based.
Yeah, those
Yeah.
are good.
Yeah, there was one that I got that they wanted to know if I wanted to sit in a boat in Boston Harbor for 4 hours. and I passed on that one.
That's what I mean, you pick and
Yeah.
choose. So some of the things you look at and say, I could learn a lot from that.
Yeah.
And then others,
Yeah.
may not work
Yes.
for you, and that's
Yeah.
what's nice about being a volunteer.
Yep.
You
Yeah, I
pick and
love it.
choose what you want to be a part of. But the education session that Sigal's talking about, the training, those are gonna kind of be a minimum, just so you know what it's like to be a volunteer and what your
Yeah.
span of control and how you may have to do something. If you're a nurse, well, we may not have you being a nurse that day. You may be doing registration, or you may be doing a different activity, and who you report to, and just how to follow that incident command is important, especially for people that haven't been exposed to that.
Good. Interesting.
I think it's very good for the community and the towns.
It is.
Never know when we'll need it.
That's right. And that's why we love the flu clinic, because that is a small piece of it. It gets, you all know the routine now, but in the beginning, people didn't know who to report to. They kept going up
Right.
to the incident commander, and it sounded mean that we'd say, no, go to the registration person,
Yeah.
which is Jen.
Yeah.
So it's teaching people that, and you all have it down now.
Yeah.
Everybody knows.
But what
the
I
routine.
think of sometimes when I think of this MRS, I think that we are lucky to have a hospital in town that can
Oh,
help us,
yeah.
and an airport to
Yeah.
get supplies in and out. I mean,
Right.
I think of that as that, it's
Oh,
very
yeah.
helpful to the town of Norwood to have these two major facilities working with us, don't you think?
Yes,
Yeah.
absolutely.
Those are some great assets.
Yeah,
Good.
All right,
I'm good, thank you.
good. On to board's agenda. Anyone, Carolyn? you
Yeah, I
have
would just
anything?
like to wish Mrs. Jacobs a happy birthday. It's Joan Jacobs' birthday, that was my agenda for today.
Thank you very much.
You're very welcome.
Happy birthday. Joan, do you have anything for your agenda?
Yeah, I don't want to be another year old.
You should do.
None of us.
Well, yes, I do.
Yes, you do.
Considering the alternative,
Yes.
yes.
Well, then I make a motion, oh no, we have to pick a date.
Yeah, we don't have January, we don't have any of the meetings. scheduled.
And before we do that, I just would like to wish everybody happy holidays,
To
Merry
you
Christmas,
too.
Yes.
Kwanzaa,
Hanukkah.
Hanukkah, sorry, couldn't remember the all. But happy holidays, happy New Year to everyone as
And
well.
safe and healthy,
Thank
happy.
you.
Yep,
Yes.
and so our next meetings,
If we went a month, it would be the 20th, but that's a
It's a
Martin Luther King
holiday,
Day.
yep.
So if we want to go to
Okay.
Tuesday or a different week.
I'm good with the 21st.
January,
Oh, I don't have a calendar.
I do.
But I'm sure I do on my phone somehow.
The
somewhere.
21st would be fine with me, that's a Tuesday?
And if we do Tuesday, can we do 10:30?
Yes, I
Yeah.
love it.
Okay. It also gets time for the camera to get down here if it's not in the room.
Tuesday, January 21st,
At 10:30?
10:30, yes.
Okay.
I'll make sure I put that in the calendar.
Do we want to do February while we're here?
Sure, why not? So then a month from that would be that's school vacation week. I don't have any children that are school vacation, so
I won't be around that week.
Well, I got a
won't be around.
whole bunch of them that I'll probably watch that week, so can we go to the
Okay.
next week?
We absolutely can.
Do you want to go to the 24th?
24th is fine.
Is that on Monday?
That's a Monday.
And
Is that
what
okay
time?
with you, Joan?
Sure.
February 24th? 25th, I have an
10?
appointment.
What are you doing, 10:30?
What day is that?
Monday,
24th is a
Monday,
Monday.
Is the
24th?
21st of January
Okay.
Can we
Monday?
keep it at 10:30 so we
Tuesday.
don't
Yeah,
get
consistent.
confused?
Yeah, I
Okay,
agree.
so
Keep it at
10:30?
10:30.
Yeah. Because I get confused easily.
Okay, but the February one is a Monday,
Yes.
Yes,
That's
February.
10:30.
10:30, yeah.
10:30, yeah, but the January is a Tuesday.
Tuesday.
Okay.
Correct. Okay,
Yeah.
okay. So we're all good with dates?
AM?
Somebody want to make a motion to adjourn the meeting?
Make a motion that we adjourn?
I second it.
All in favor?
Aye,
Aye.
thank you.
We are adjourned.